Hey, it's Dr. Del Grosso from SF Chiropractic. I want to talk a little bit today about something called TOS, or commonly it's Thoracic Outlet Syndrome. It's something you don't see a lot about, and it's something that's good to talk about only because it sometimes is misdiagnosed, only because of the fact that there are so many symptoms. I mean, symptoms of Thoracic Outlet Syndrome can be anything from ringing in the ears, to stiffness in the neck, to coldness in the hands, tingling in the hands, to pain across the shoulders. I mean, the symptoms can go dizziness, vertigo. The symptoms can go on. And a lot of times we have these symptoms and we think other things. And sometimes, if the symptoms aren't resolving, there's a good chance it could be the thoracic outlet or TOS. Okay, let's talk a little bit about what it is. You have nerve arteries and veins travel in bundles. They always travel together. And you have certain areas where they travel through passages. One of those areas is up under the arm, the brachial plexus. Another one of those areas is between the first rib and the clavicle. And that's where these vessels travel through. And sometimes what can happen is they can get entrapped there, mostly because of the muscles. Sometimes it can be scalene muscles. It can be SCM muscles can cause some entrapment. But it's some entrapment there where there's a lack of, a lot of times with thoracic outlets, circulation. And that's why the tingling and the coldness in the hands, different things. But remember, they travel together. So if there's a problem with one and there's some inflammation there, some irritation, it can also cause some inflammation in the nerves and other things as well. There's a lot of things we can do for it. One of them is the adjustments. If we can identify it and find it, we can work in the upper part of the thoracic spine there at T1, where the first rib is, and at the bottom of the neck, C7. In that area, we can work with the shoulder a little bit, the clavicle. We can also work a little bit with stretches and exercises. There's a lot of things you can do to help with that. There's a couple easy ones that I could tell you right off the bat. One is a shoulder shrug, where you actually just squeeze the shoulders back and squeeze your scapula together in the back of your, in the back of the upper part of your back. Another one's just to put your hands behind your back like this to open up and just tilt the neck from side to side, okay? Again, stretching scalene, stretching SCM a little bit, okay? Putting the hands up on the wall and moving them up like this is another one. There's a lot of things we can do to try to take some of that pressure off, okay, and help open up that opening there and get some of the pressure off that nerve artery vein to relieve some of your symptoms for thoracic outlet. So please, if you have any symptoms, whether you think that's it or not, like I said, dizziness, headaches, especially coldness in the hands, tingling in the hands or something, come in, let us take a look. There's a good chance it could be TOS, okay? And we can help with it, and it's something that's not real difficult to work with. It's something that we can help. Relief is usually pretty quick. So please, come in. Thank you.